This is the temporary COVID unit that was built at Joseph Brant Hospital at the start of the pandemic. It's available for any hospitals in the region unable to cope with a sudden surge in patients. But so far, it has not been used. Ideally, patients will continue to be treated inside a traditional hospital.
What I would like most for Christmas is we'd have to keep the pandemic unit closed.
The Ontario Hospital Association says this is far more serious than the first wave of the pandemic. And Joseph Brant Chief of Staff Dr. Ian Pereira agrees.
With those rising numbers, we're seeing increased pressures on the hospital sector, especially in acute care and critical care. So, for example, in Halton Region, our acute care capacity is about 93%, but our ICU capacity is at 98%. So there's not a lot of wiggle room here.
Niagara Health is also concerned about rising rates in its community.
We are right now at 42 cases in our hospitals, which is really the highest that we've seen in hospital care since the beginning of the pandemic.
And at Hamilton Health Sciences,
like all areas of Ontario, the system is at overcapacity.
Ontario Health has told hospitals in red or lockdown zones to immediately create capacity. Hospitals in lower zones should get ready to create capacity.
We know that kind of community transmission of the virus is going to translate into hospitalizations and then ICU beds, in the weeks to come.
Hospitals create capacity by speeding up transfers to other places like long-term care homes and moving non-urgent surgeries.
And coming into the holidays is typically a time when we reduce that kind of scheduled activity anyway.
Hospital capacity is not necessarily about physical space or equipment like ventilators. It's about having enough qualified people to work in healthcare. And during a pandemic, employees are susceptible to outbreaks.
Looking around the community, driving home from work in the COVID clinic and seeing the parking lot of Mapleview Mall packed with people, it really frustrates me.